This medication acts like the natural glucagon in your body, which helps raise blood sugar levels by releasing stored sugar from the liver. It is primarily used to address severe low blood sugar episodes, hypoglycemia, that may require assistance from others. It's crucial for a family member or caregiver to be aware of where the medication is stored and how to administer it before assistance is needed. Remember to read the patient information leaflet and instructions for use leaflet provided by your pharmacist each time you receive a refill of Zegalogue. It's important to keep this medication handy in case of a very low blood sugar episode, as it should be treated right away to prevent serious effects such as brain damage. You and your caregiver must learn how to properly give this medication, as each auto-injector/syringe can be used only one time. Caregivers should also know the symptoms of low blood sugar. It's important to remove the auto-injector/syringe from the package only when you are ready to use it, and to check the product visually for particles or discoloration before using it. Zegalogue should be injected under the skin of the abdomen, thigh, buttocks, or upper arm as directed by your doctor, and it should not be injected through clothing. The dosage is based on your medical condition and response to treatment, and after giving this medication, the caregiver should seek medical help right away. If the patient is unconscious, turn them on their side to prevent choking in case they vomit. If they do not wake up after 15 minutes, another dose may be given, if available. When the patient wakes up and is able to swallow, a quick sugar source should be given, and the blood sugar level should be kept up by eating snacks such as crackers, cheese, a meat sandwich, or milk. Always call your doctor right away when an episode of very low blood sugar has happened, as you may need more medical treatment or your insulin dose and diet may need to be adjusted. Some common side effects of Zegalogue 0.6 mg per 0.6 ml subcutaneous syringe glucagon and analogs include nausea, vomiting, headache, and irritation, redness, or swelling at the injection site. If these effects persist or worsen, it's important to consult your doctor or pharmacist. However, it's important to remember that this medication has been prescribed to you because the benefits outweigh the risk of side effects for most people. While serious side effects are rare, it's essential to seek immediate medical help if you experience a fast or pounding heartbeat, or symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. Before using Zegalogue 0.6 mg per 0.6 ml subcutaneous syringe glucagon and analogs, make sure to let your doctor or pharmacist know if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions or other issues. Also, inform them about your medical history, especially if you have a pancreatic tumor, adrenal gland problem, or if you have poor eating habits. Low blood sugar is more likely if you don't consume enough calories or do heavy exercise. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. It's a good idea to carry glucose tablets or gel to treat low blood sugar. If you don't have these, you can raise your blood sugar by eating a quick source of sugar or drinking fruit juice. Make sure to eat meals on a regular schedule and don't skip meals to help prevent low blood sugar. If you are pregnant or breastfeeding, consult your doctor before using this medication. When taking Zegalogue 0.6 mg per 0.6 ml subcutaneous syringe glucagon and analogs, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's essential to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Zegalogue 0.6 mg per 0.6 ml subcutaneous syringe glucagon and analogs. If someone has overdosed and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share this medication with others. If you are using Zegalogue 0.6 mg per 0.6 ml subcutaneous syringe glucagon and analogs, it's recommended to attend a diabetes education program to learn more about managing your diabetes with medications, diet, exercise, and regular medical exams. It's also crucial to learn the symptoms of high and low blood sugar, as well as how to treat low blood sugar. Make sure to check your blood sugar regularly as directed by your healthcare provider. The Zegalogue 0.6 mg per 0.6 ml subcutaneous syringe is used to treat severe low blood sugar, hypoglycemia, in adults and children who have diabetes that is treated with insulin. This medication is used when a person with diabetes has become unconscious due to severe low blood sugar and is unable to take sugar by mouth. This medication is also used before a medical procedure to block the effects of medicines that cause low blood sugar. This medication is a hormone that raises blood sugar levels. This helps to reverse the symptoms of low blood sugar. When storing Zegalogue 0.6 mg per 0.6 ml subcutaneous syringe glucagon and analogs, it's important to keep it in the refrigerator away from light and moisture, but do not freeze it. Alternatively, you can store it at room temperature for up to 12 months, but if you do not put it back in the refrigerator. Make sure to throw away the product if it has been stored at room temperature for longer than 12 months. Remember to keep all medications away from children and pets, and do not store it in the bathroom. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.